Joint replacement surgery is a lengthy process that many people often undergo. Luckily, the orthopedic care and team at UofL Health does their best to ensure an easy surgery. However, there are still some issues in joint replacement surgery to this day. Joining me to talk more about these issues is Arthur Malcani of UofL Health Orthopedics. Thank you so much for coming in today. And so, why is there an increase in the number of patients undergoing a total joint replacement?
Well, thank you for inviting me. Pleasure to be here.
Yeah.
So joint replacements, mainly hip and knee replacements and even shoulder replacements, performed on a regular basis in America for now. It's been ongoing for almost 4 or 5 decades.
Mm-hmm.
But the growth has been quite significant, mainly because we're all living longer.
Right.
So the average lifespan has increased significantly, and so there's multiple reasons. We're living longer. A lot of our patients who are pretty athletic, they start out very athletic, they can get their knees traumatized from injuries, things like that, so sports injuries. And then also we're a heavy population. If you look at our obesity, it's pretty, past 20 years, it's pretty significant. And so it takes a load on the joint. So your joints wear out faster because you've been putting extra load on that joint over the past 20 years or so. So for multiple reasons, but the numbers are just incredibly expanding over the past 10 years.
Yeah, and so it's kind of interesting to hear that it's on both ends of the spectrum, where you're a super athletic person and you're very active, but also, the overweight population as well. They both tend to get these surgeries. And so what are some of the significant improvement in the modern day total joint replacements?
Yeah, so there's been an evolution of arthroplasty, we call it, hip and knee replacements and shoulder replacements. So way back when, back in the 80s, 70s, the implants were a few sizes, not ideal, but it's the best they had back then. Mm-hmm. And most of the patients back then were elderly patients, really stiff knees, so they were happy just to get rid of the pain.
Yeah.
Now we have younger patients, we have people in their 50s. I have firefighters, I have people who ski, who ride bicycles. It's a different generation of patients who are getting joint replacements. Mm-hmm. So the implants are phenomenal now. They're more durable. Some of the evolutions have included, instead of using cement, they're cementless, where you cut out the middleman, so they're more durable. So some of our implants now are the bonding is almost lifelong. Then you have technology, which has been again a big evolution in our joint replacement. So you don't see a Boeing engine being made with a guy with a chisel and a mallet. It's all computerized software.
Yeah.
Well, that's what we're doing for joint replacements for almost 3 decades. Now we have technology where it kind of helps us, tells us where to put the parts to match the patient's anatomy. Mm-hmm. So that accuracy, that precision leads to better patient outcomes. Our patient satisfaction is almost 95% with joint replacements now. Before the computer technology days, it was a little bit less than 80%. So the technology has improved, the materials have improved, and all this is because of competition. Mm-hmm. When 2 companies compete, we get better products. And
yeah.
That's been a godsend for us to have better products. We have satisfied patients, and our approaches and procedures are safer, less complications. Mm-hmm. So it's been a pretty incredible evolution to where we are.
Yeah, and I feel like a lot of people, though, it's pretty daunting to undergo a surgery, but kind of describe the process on preparing patients for that big surgery.
Yeah, so much of life is what you bring to the table. If we just can't have a healthy 50-year-old person come to the office.
Right.
We have all walks of life, mm-hmm. and so a lot of our patients, 20% of my patients are what we call octogenarians, people in their 80s, and they have cardiac stents, they have kidney dialysis, they have medical problems, so we have to optimize them. So to minimize complications, we have to get them in shape for the surgery. Just before football season starts, you
have that training.
Exactly. That's what we have to do. Maybe get their weight down, get a little physical therapy, make sure their A1C levels and diabetics are optimized. So get them healthy so they can have minimized complications afterwards. So every patient is different. You have to pay attention to what they bring to the table. Mm-hmm.
And also bringing to the table insurance. So why are insurance approvals becoming more difficult for patients choosing to do this surgery?
That's a good question. Well, I think it has to do with, so we're living longer. It's a tremendous cost to the healthcare system when we have all these operations. So we do over 1 million knee replacements in America nowadays. 10 years ago, might have been maybe 700,000 or 600,000. So the numbers are going up, so you have to pay for them somehow.
Right.
And so our insurance companies now want us to make sure that they dot the I's, cross the T's in every aspect, to document every little thing that we need to make sure they've failed physical therapy. It's challenging. Someone comes to you in a wheelchair with really bad hips, they can't walk. It's hard to do therapy. So, so they have to. So it's a tug of war a little bit. You know, they mean well, but sometimes it's just not realistic.
Right.
And so you have to sort of prove to the insurance companies that this patient really needs an operation.
Yes, well, thank you so much for coming in to learn a little bit more. Give them a call at 502-587-8222 or their website at uoflhealth.org. Thank you so much for coming in.
Thank you.